Good morning and happy Monday. This is Katherine Watson. I'm here with the Life After 50 show. It's what you need to know for the second half of your journey. We've had a few technical difficulties this morning, but we're here on a happy Monday. And I've got a great guest as always. I've really been fortunate to find some amazing guests for our show. Um, this show is sponsored today by FindHoustonSeniorCare.com. This is a web directory where people can go and search for hospice companies, elder law attorneys, home care companies, assisted living, and so much more. On Find Houston Senior Care, you'll find over 500 articles, podcasts, and videos to help you navigate the challenges of caring for an elderly loved one. I'm here today to talk about something that a lot of people don't talk about, at least in our society. We don't talk about death, dying, hospice. Those seem to be kind of taboo words. Well, I'm here to change all of that. I'm here to try to shake things up because it's time that we talked about these different subjects. It's time that we brought hospice out of the closet and helped people to understand the wonderful service that you really need to know about and how it can help you and your family. We're here to talk about what happens during the dying process when somebody has entered the final stages, maybe the last day or two. What kinds of changes might families expect to see and experience? And I think it's important to talk about these things because if you don't know what's going to happen, it can sometimes be frightening. And we don't want that to happen to you. Hospice is a team approach, and they will help walk you through all of this. So today, I'm here with Shanice Ferguson. She is a registered nurse, and she is with White Orchid Hospice Company here in Houston, Texas. She has 17 plus years of hospice and palliative care nursing under her belt. That's a long time. My guess is she's seen a lot. She currently serves as a clinical director and program administrator for White Orchid Hospice. And she attended Prairie View A&M University, where she received her RN and her BSN in nursing. She went on to receive her hospice and palliative care certification. And she's currently working on her master's degree. Quite frankly, I don't know when she has time to do all of this. But I'm not going to say much more about her. I'll let her tell you a little bit more if she wants to, but I want to bring her on. I want to get the conversation started. So let's bring Shanice up into the broadcast now.
Good morning.
And there we are.
Thank you.
Hi, Shanice. How are you?
I'm doing great, Catherine. Thank you for having me this morning.
Oh, thank you for taking your time to be on the show. We really, really appreciate it. So, Shanice, this is near and dear to your heart, right?
Very.
Yeah.
Very near to my heart.
So what is it about this business that is so near and dear to your heart, and why are you so passionate about wanting to get the information out about hospice and how it helps people?
Well, a lot of people who know or don't know about hospice, but have been exposed to end-of-life care, it speaks to our heart. You know, a lot of people who are in this industry and in this field, you have to be more or less called to it. It's not something that you just decide to choose. So my story and my journey is one where I've been called to this field. And so my life's work and my goal is always to focus on families and now more or less educating the community about end-of-life care options, how palliative care is a little bit different and distinct from hospice, and what end-of-life really looks like and it means, and how it can be so impactful for families who underutilize this service. But like what you had spoke to earlier, I think that speaks to the larger issue and hopefully the dialogue that will be discussed today, which is, hospice, the word moving forward, and how, the word just as a stigma attached to it. And really what it speaks to is, in this country about, our mortality and our inability to talk about, end of life care. And it's something that we really need to address, because when we address it, as they say, we address the elephant in the room. That empowers people to be able to make good, wise decisions for their loved one. It just not only affects families, but it affects the community at large. And so I feel like, by us having this discussion, being a part of, open discussions on shows like this gets the message out in which hospice is an underutilized service, that, hospice is here to help families in crisis who are dealing with, acute symptom management and with a life limiting illness that the family really does need help or assistance with. And it's
Yeah.
basically just having that immediate, need met, but more or less helping the family understand. It first starts with like what we're discussing, the dialogue, understanding,
Right.
and opening that up.
So, Shanice, I sometimes get a little confused over the difference between hospice and palliative care. Can you
Yes.
kind of explain that and when one would be appropriate over the other?
Yes, absolutely. And that's a great question, Catherine. Palliative care is more or less, or hospice is under palliative care, because palliative care is an umbrella of care that is right after curative. Palliative care encompasses a lot of different things, and it's also patient specific. But just basically, the foundation, the core tenets of palliative care focus on comfort and every symptom management. And what that looks like means that it will be very separate and distinct for all different patients. So you have to be recommended, or have an order for palliative care, from your doctor. And most importantly, what I would like to convey to families, as far as when you're looking and the discussion of palliative care comes up, the distinct difference is that there's an illness that no longer can receive aggressive treatment, and the actual protocols that will be in place to see how you receive the palliative care are based on your illness. So when the doctor has that first initial discussion, that means that you're transitioning from home health to palliative care. And then under palliative care is hospice. And hospice is really when you are in the last 6 months of your life, and the also same thing, comfort driven symptom management and palliations of everything related to that terminal illness.
So, Shanice, let's talk about that 6 month thing
Yes.
because I'm going to tell you, my mom went home from the hospital and they actually said she had about 3 months at the most.
Right.
And she was on hospice for the next almost 2 years.
Yes.
So I think this surprises a lot of people when I say that
Yes.
sometimes it's much longer. And one of the reasons is that you're getting really good care when you're on hospice. And I think there's even been some studies that have shown that people on hospice care actually live longer than people who did not opt for hospice care.
That's a very good point, Catherine, and that's 100% true. There are statistics that show that on average, people live about maybe a month or 2 months longer. There's a window, so it's anywhere from 60 to 90 days, where it shows, studies have shown that the intensive, individualized care that hospice and palliative care brings to the table does enhance and promote the quality of life. And that's the whole thing as far as why loved one or family member would choose hospice. It improves the quality of life. It's not the number of days, it's the quality of days. And that's what I
Mhm.
always like to make sure that the focus of care, the people always understand. Once we get past, the certain understanding as far as what it all encompasses, what the care looks like, what they can expect. But you're right. The biggest thing that families don't understand, or the misgivings, is that it only is if someone is for 6 months. Now Medicare does have a requirement that says that a person has to be certified with 6 months or less to live, but Medicare does not timestamp or does not kick people off or prohibit them from being or receiving the service if they live beyond that timeline. So people need to
Right.
understand that.
Yeah, yeah. And the fact of the matter is nobody but the guy upstairs knows
That's
when you're
right.
going to go, right?
There's
I
a
mean,
guy.
a doctor is only going to give you their best guess estimate.
Medical
When they
opinion.
sent my mom home, they really truly believed that she would not last longer than 3 months.
Right.
And my mom even fooled the hospice team many times. They
Yeah,
thought it was the end and then she'd pop back up.
that's
She
right.
just wasn't, it wasn't her time yet, and she wasn't ready to go. And until that time comes, she was going to hang around. So
That's right.
I think people need to know. But one thing I want to talk about is what we found out with my family, with my mom with hospice. Mother was 91, I believe, when she went on hospice, 93 when she passed away.
Yes.
And she was completely bedbound. The hospice team, I'm telling you, we could not have done without it. And that's what I want to talk about. It's a team approach. So,
Team
talk to
approach.
us about the different people that are on the team and how each one can help families.
Okay, that's a great question as well, Catherine. Well, on hospice, there is what we call in hospice the core team or the core services, and that what the team members that involves are a registered nurse, the medical director, the home health, well, I'm sorry, the medical social worker. Now, the other people outside of the courts team or the core services that are offered are the home health aide and the chaplain. And under certain conditions, more on the palliative care side, we have PT and OT, occupational therapy. And unlike home health, hospice, for what you had mentioned, completely approaches everything that we do in a team oriented approach. That's why
Mhm.
Medicare sets the standard and is a requirement that we meet as an interdisciplinary team every 14 days to come and review the established plan of care that is set up, when a patient is admitted under hospice or palliative care services. And so that means that the nurse, the chaplain, the social worker, the home health aide, we all come together every 15 days and we talk about all the needs, what's going on with the family, from the medical to the psychosocial to the activities of daily living to the supplies to, the family, because Medicare requires hospice not just to take care of the patient. They require us to take care of the family. And that requires a team approach. That requires us to,
Mhm.
address all the physical, psychosocial, spiritual needs of the patient. That's what encompasses and what makes hospice the beauty of what we do. And, every aspect of the patient's care, is also focused on the family as well, the family unit. Because at the end of the day, we're not just taking care of somebody with a life limiting illness, we're taking care of people with bereavement needs. They're about to experience
Mhm.
the most difficult time of their life, which is losing their loved one. And so, for that, we are specially trained in the area to help families in crisis or who are dealing with someone with a life limiting illness. And that's why we seek and we look for families early on and not just the last week of life or the last 48
Mhm.
hours. That's where
Absolutely.
the
Yeah.
benefit of what we do comes full circle, and how we in hospice say the hospice heart. It allows us to really be able to connect with the family on an emotional, spiritual level that is wonderful. It just such a great service. And it's like I said, the fact that it's underutilized is one of the reasons why we're doing this show today. It's because we need to have this dialogue. We need to reach families. We need to
Mhm.
let them know about the service. We need to let them know that they don't have to go through this journey by themselves. It's something
Absolutely.
that's totally
Absolutely.
out here for them.
Yeah. So, if there's anybody out there that's watching this broadcast, please feel free to add your comments below. Ask questions. If you have a question for Shanice, we'll be glad to put it up on the screen and answer that for you. So, if you have anything that you want to know, now is the time. You don't have to be in person to do this. You don't have to call anybody. You're right here on Facebook. Just go ahead and ask some questions. Shanice, I know when we went through hospice, it was the team approach was what impressed me so much because
Yes.
there's really no other type of healthcare that I felt that real team approach. They seemed to work together. It was nice for me to know that there were multiple people coming to see my mom on a regular
On a
basis.
regular
And then my
basis.
mother-in-law, when we had her on hospice, and by the way, she was on hospice for 7 months. So
Right.
she went past that 6 month window too.
Right. It's true.
But this is, the things that hospice does for families. There's so many things in the background that you probably don't even think about anymore because it's just routine.
Correct.
For instance, when we came home from the hospital, they made sure we had the proper kind of hospital bed. They took care of all of that. I can't tell you how it sounds like something small and trivial, but when you're stressed out, when you're have been at the hospital for days on end with somebody who is in really bad shape, and you're worried and you're scared and you're going through all these emotions, you don't need to be having to figure out where do I go to get a hospital bed. So it was, just little things like that. They took care of her medication after that. We no longer had to pay for her medication. That's a Medicare benefit. So that was really nice. Um, they took care of just a lot of different things.
Correct.
They also had volunteers that helped out too. And I just want to tell a little story about a guy named Charlie. When mom was going through hospice, I would go every other week. I lived in Houston and she lived in Louisiana. So every other week I stayed from Friday through Monday to give the caregiver a break. And some weekends were blissful and beautiful and wonderful, and other weekends were not. Some weekends were scary and dark, and all kinds of emotions were going on with both her and me.
Mm-hmm.
But I could always count on Saturday morning at 9 o'clock. Charlie with hospice would call to see how I was doing. And that meant
Right.
so much to me. So, yes, hospice takes care of the whole family.
Yes, we do. And
And they helped walk us through some of the emotions that we were dealing with. So that's a big plus. Um,
Catherine, it,
One thing I want to talk about too, Shanice, is when that dying process begins.
mhm,
And it's different for everybody.
it
Okay,
is.
I've been with a number of people that have passed away,
Right.
and they don't all have the same symptoms,
No, they do not.
but some of them do have some things that happen. And one thing I want to bring up, because a lot of people don't even know about this, but it's called the death rattle. And I'd like you to just please explain what that is, why it's happening, and if it happens to your loved one, how the hospice team can help, because they were a huge help.
Yes. Well, like what you had mentioned, a lot of people experience death and dying in a very distinct way. But I always try to explain in the last stages when someone goes through an illness, it's just like childbirth. There are clinically some things that are going to happen. And one of the things that you had mentioned is the death rattle. And the death rattle basically can just be summed up, that it's one of the cluster of symptoms that you'll see as far as someone who's going to be dealing with in the last stages of their illness. So with respiratory changes, pain, different other things that are going to be happening, the changes in the level of consciousness. But going back to speaking to the issue of the respiratory changes, because that's one of the first marked things that you'll see is them having respiratory changes. So the respiration will go up higher to where they become, they're breathing rapidly, to where it starts slowing up. And then they have other breathing changes, of which the hospice nurse explains. But more specifically, the death rattle happens when people get fluid in their lungs, and they towards the end they become what we call having difficulty swallowing. It's called dysphagia. And typically somebody will swallow, or they'll have some changes related to getting something in their lungs, and then that's what you'll see. typically is that when the gag reflex has become impaired and fluid has gone, so it's basically like, let's just say they aspirated or they choked. Well, when that happens, fluid will gather in their lungs and there'll be increased secretions, and then that's when you hear that audible sound. And I've heard people describe it as like a percolator, but it becomes very much more pronounced with certain people and certain
Yes.
disease processes. And so, like what you had experienced, not everyone will go through that. Not everybody will have that experience with having the death rattle. But when they do, patients do have it, it's very traumatic for the family. And so,
It is.
what we in hospice like to do, if with the hospice nurse and the full team, typically, even the chaplain or the social worker, they're astute and they do some teaching, but more importantly, they'll reach out to their nurse RN case manager for hospice, and they will go ahead and make sure that the nurse jumps on it. She will, of course, in turn call the medical director, get appropriate orders, and then that'll be addressed. And then, of course, from that point, it'll be a lot of teaching with the family in terms of how to administer the medication. And there are a few protocol or comfort medications that are given to help alleviate that symptom.
Yeah. And I was so grateful that before it happened, I knew about it. It
Yes.
still was unsettling when I
Very.
heard it, because
Yeah.
knowing and hearing are two different
Two
things.
different
But
things.
at
Yeah.
least I knew about it,
Hmm.
and I knew that my hospice team could help.
Yes.
And I was able to help my husband understand what was going on, and that it was just part of the
The
process, and
process.
that it was okay. And then we reached out, of course, to hospice, and they came in and were able to help kind of settle her down and help my husband with understanding it better. So, that's important. What other kinds of things might people experience?
Some of the things that families might experience are like what I had mentioned before. There's three classic things that happen, in the last stages of someone's life. If they, not everybody's going to have pain on hospice, but it just depends on, what their illness is. But most of the time, what hospice has to help manage and what we're known for is pain management, because
Mhm.
most people do unfortunately experience some level of pain. And so that requires, adjustments in their medication, that requires, pain management. And so one of the typical things that we'll see in hospice is, changes in their pain level. And as they, move closer towards the last days, the last weeks of life, we'll see pain, people's pain will change. We will
Mhm.
also see, in the last stages, people will start sleeping more. They'll what we call changes in their level of consciousness. And so families will think sometimes that it's the medication, the pain medication, when really towards the last stages of an illness, when someone is really about to, transition, is what we call it in palliative
Mhm.
care hospice, they will be sleeping more. And so sometimes we have to educate the family that even if we take your loved one off of the medication, it causes the challenges of their pain is not being managed, and then also they're now sleeping a lot. But what we have to make sure we educate them is, no matter what we do, they're going to sleep more. It
Mhm.
becomes to where we explain to the family and educate them that people are moving more inward, and they're going to be able to, interact with you less outwardly. And that's what we want, because we want people to have a peaceful life review. We want people to go through the process to where the family is, okay, and tells them that mom, dad, or whoever, it's okay. All of us that are here, we will be fine. Patients, they need to hear that, because
Mhm.
you know and families need to understand that they are alive until they take their last breath. So while they may be going through the symptoms of, actively dying, they can still hear everything that you say. They cannot respond to you in the way that we were used to engaging and interacting with them, but that should not frighten the family anymore, to the point where they don't have a communication with their loved one more.
I I think that is so important. I'm so glad you brought that up,
Yes.
because my two nieces lived quite far away when my mother-in-law was transitioning,
Transition.
and we called them on the phone, and we allowed them. We put the phone up to her ear,
Mm.
and they were able to talk to her and say their goodbyes. And that was
Yes.
very healing for them. But I saw a response in her. I
Yes.
could see her face change and kind of light up a little bit. So
Yes.
I know she heard them.
Yes.
There's no doubt in my mind that she didn't hear them.
No.
So, this is, really good for families to know,
Hmm.
because sometimes they are spread across the country or maybe even
Correct.
across the world. They're far
Yes.
away and they can't get in and they're not going to make it in time.
Right.
So you can call, have somebody put the phone up to their ear
Correct.
and say your piece, talk to
Yes.
them, tell them
Talk to them.
goodbye, tell
Tell them
them you love
goodbye.
them. And that I think that is huge,
That is
huge.
huge. That is
And
huge.
Shanice, I hate to say this, but we're at the end of the show.
Oh my
This
goodness.
has just zipped by so fast. There's so much information, but I'm sure we'll have you on again, because there's still a lot that we need to talk about.
Okay.
This is a huge subject, but hopefully we've gotten a little bit of information out there for some people. And if you have questions, please feel free to put them in the comments. I'll get Shanice to come in and answer your questions, or we'll have somebody from the hospice team answer your questions, and try to get you the help that you need. But don't be afraid of the hospice word. Don't be afraid of it at all, because it is a blessing like none you've ever experienced before.
Catherine, that's a
So,
beautiful thing. And I did want to speak to that a lot. I always like to say, give the gift of hospice. It will be one of
yeah.
the best gifts that you can receive. And I think it is. And I wish that more people would be able to express and put those words together with hospice instead of having it be a negative connotation. Hospice is a gift, and it's, your ability to understand what it's about and how it can be so impactful and meaningful for your family is really very important. So I think that, this whole discussion this morning has really been wonderful. But I feel like, when we talk about hospice, I really do like to, make sure that families understand that it's a gift. And
Yeah.
we're, us clinicians who are in this field, we have a hospice heart, and our hospice heart allows us to be able to do what we do. And once again, hospice is a gift, and I hope people can think of hospice along those lines.
Thank you so much for taking your time to be on the show. So we really appreciate Shanice today. For those of you who watched or are watching the replay, again, if you have questions, feel free to put them in the comment section below, and we'll try to get those answered for you. But this is the Life After 50 show. Every week we come to you with more information, things that you need to know for your journey in the life after 50. We are going to be taking a summer hiatus in July, so there will not be any fresh new shows in July, but we'll be sending out excerpts of some of our previous shows that maybe you missed. So I'm going to be sending out some excerpts of the shows on Mondays for the month of July, and we have got a great lineup for August coming up. So I will be posting that information in July. Stay tuned. Make sure that you follow the Life After 50 show. Thanks so much. Have a great day.